If you have a loved one living with bipolar disorder, you've likely experienced the roller coaster ride that comes courtesy of the condition, and it can be a wild one. Here's how to help when they become non-compliant. Marked by major moods that swing from extreme highs to the lowest of lows, finding a balance is a matter of medication. In fact, medication is key to treating this mental disorder. Bipolar is a lifelong condition, says Randy Bressler, PsyD, visiting clinical supervisor, Rutgers Graduate School of Applied and Professional Psychology, with practices in Millburn and Randolph, New Jersey. Due to their wiring and genetic makeup, patients have difficulty producing the chemicals needed to regulate mood and emotion, which is why medication is so important. But when that person refuses to take their meds, the effects can be like a superstorm destroying everything in its path. Without medication, there could be severe consequences related to poor decision-making, at-risk behaviors, sleeplessness, spending sprees, social withdrawal, lack of personal hygiene, trouble meeting professional or school obligations, psychosis, or worst case, suicide, Bressler says. While non-compliance can be caused by a number of factors, from side effects to forgetfulness, it can also be triggered, and the holidays, even more so in the midst of a pandemic, are a particularly vulnerable time, Bressler says. Those with bipolar and other mental illnesses may feel isolated, or so joyful they might think they don't need to take their meds at all. And if there's a history of addiction, such as alcohol, they may turn to drinking as a coping mechanism, he says. All the more reason why a support system is key. If your friend or family member becomes non-compliant, don't panic. Here's how to handle the situation like a pro. 1. Be supportive. Just listening to your loved one can go a long way, and reveal any roadblocks they might be experiencing. Studies show social support can help prevent relapse, encourage better treatment adherence, and improve the person's functioning overall. Listening and empathizing can give you a better understanding as to what factors might be leading to their noncompliance. Perhaps they aren't tolerating the side effects from the medication, think their meds aren't working, are forgetting to take their meds, or have agnosia, a feeling that they don't have an illness at all, Bressler says. Some of these factors, such as side effects, may be easily managed by making simple tweaks to current dosages or by trying alternate medications. Or, if it's a cost issue, there are platforms such as RX Assist or GoodRx, which can help find lower-cost meds, and the National Alliance on Mental Illness, NAMI, which provides resources for assistance with payment. 2. Get educated. Arming yourself with all the knowledge about the condition can help you become more aware of warning signs, symptoms, and any potential side effects of the meds to look for, Bressler says. Families shouldn't wait for a crisis before intervening. You don't want symptoms to be constantly toggled like a switch, going from the extremes of light to dark. You want to carefully observe the person, so symptoms are more like a dimmer and you are able to intervene before they become pitch black. 3. Make med management mobile. If your loved one is having a hard time remembering to take his meds in the first place, provide help at the palm of his hand. Bressler recommends installing an app like Medisafe on his phone, which sends alerts to take meds, offers info about side effects, and even enables caregivers to receive notifications as well. A failsafe for sure. For someone disorganized, an app can help them plan and self-monitor in a very user-friendly way, Bressler says. 4. Remind them of the risks. Having good communication is incredibly important, and even more so when a patient is non-compliant. As a trusted friend or family member, you have power, and they will be more inclined to listen. Explain and emphasize the consequences of being off medication and how it can affect functioning. Remind them of how bipolar has impacted them historically and of any significant consequences of their actions, Bressler says. Emphasize the benefits of medication, that it won't take away their personality, a fear that some people have, but it will help even out the peaks and valleys of their emotional reactions, he says. 5. Encourage them to seek treatment. Hopefully, they are already under the care of a mental health professional. If not, they need to be, stat, and you should urge them, or better yet, go with them, to see their provider. Studies show family-focused therapy can help speed up recovery from mood episodes, reduce recurrences, and lessen the severity of symptoms. A mental health professional is integral for a successful response, and having someone be compliant with meds, Bressler says. A professional lens can help navigate stressors that could be triggers for manic and depressive episodes and serve as a constant, reliable support. Your loved one may feel more comfortable disclosing sensitive information to her doctor than she would to family members, a significant other, or friends. Having regular check-ins should be a part of the protocol, he says. And, if it's a child with the condition, the school nurse can assist caregivers with dispensing medication and be on-site support for a child who may be exhibiting symptoms. 6. Put a reward system in place. For young children with bipolar, parents should reward them for being compliant as if they were doing a chore in the house, Bressler says. A parent may give more screen time, let the child stay up a little later at night, or choose a meal for the family. Associating a positive reward with taking meds reinforces healthy self-care and responsibility and educates the child about their diagnosis. It's about teaching more of a life skill. While you can't exactly reward an adult for being compliant as you would a child, you can remind them what it's like when things are stable, chaos is reduced, there's increasing stability with relationships, employment, day-to-day functioning, etc. The incentive is what it's like to get to that point again, Bressler says. And on the flip side, you may need to give them ultimatums, by saying something like, "You need to get treatment, or you'll put me in a position to place you into an inpatient unit." 7. Seek safety in numbers. Sometimes, knowing and connecting with other people experiencing the same thing can help a patient better navigate and manage their own condition. A supportive environment, such as the Depression and Bipolar Support Alliance, DBSA, is a safe space not only for those suffering from bipolar, but for their caregivers, too. The organization provides education, tools, peer support, as well as stories to help empower. Connecting with others and relating to those going through similar circumstances, whether they're having medication issues, challenges with relationships, or understanding their illness, can help a patient feel less alone, Bressler says. 8. Make treatment more accessible. Some patients may become easily overwhelmed with medication maintenance and keeping up with the mental health appointments needed to manage the condition, and really daily life for that matter. Sometimes an illness can impede decision-making and follow-through, so having a trusted support team can help the person suffering from the condition navigate things we take for granted, physically getting to their physician, setting up medication reminders, etc., Bressler says. Even more important is just being available to listen when they're feeling under duress. 9. Have a plan. Be prepared with a few options for therapy, treatment, or inpatient care in your back pocket. Noncompliance could be a safety concern for the patient and their family, so it's important for those around them to act on their behalf, Bressler says. Make sure you have their mental health professional's number on speed dial or be aware of the nearest emergency room. Sometimes patients need to reach rock bottom before they recognize they need the help, he says. 10. Consider long-acting injectables. For those who have a history of noncompliance, a long-acting injectable antipsychotic medication may be a good option. Studies show poor adherence to meds is associated with depressive episodes, an increased risk of hospitalization and emergency room visits, and increased employee costs due to greater absences. Risperidone, the only FDA-approved long-acting injectable for bipolar, is a monthly in-office treatment, which means it's not something that needs to be managed daily, Bressler says. While it's effective for managing symptoms, the downside is, it's harder to make adjustments because it's already in the body, so it tends to be a later resort. While it should be covered by insurance if it's part of standard care, if not, a payment assistance platform can help cover costs.